Good afternoon, everybody. This is Lacey Sloan. I'm one of the UNICEF consultants helping University of Juba implement their new certificate of social work program. And so I've been fortunate enough to meet Dr. Saleh and his colleagues and work with them on this program. And so today I am doing our second workshop, and it is a different topic than we originally had on our agenda, but we realized that human sexuality and reproductive health education is a topic that you all will be teaching a course on in the certificate program in the second semester. So we decided that this might be more helpful than the workshop we had intended on using case studies and developing case studies, although we can still do something on that at some point if people are interested. So the one thing about doing human sexuality and reproductive health education is that we have to be comfortable with words, with descriptions of sexual behavior, and we have to understand how human sexuality works. So I'm going to tell you right now that I have the next slide is words, just a whole page of words that are sometimes used in describing human sexuality. And in a few slides, I also have some anatomy slides. These are drawings that are of the female reproductive organs and of the male reproductive organs. Towards the end of the presentation, hopefully we will get there, I have slides on sexually transmitted infections. And these are actual slides of genitalia with a different sexually transmitted infection. So I wanted to warn you ahead of time that we're going to be explicit in what we're talking about. First, we're going to talk about words, then anatomy and physiology. We're going to talk about contraception, pregnancy, childbirth, heterosexual intercourse, and then how do we challenge harmful sexual behaviors or behaviors that result in harmful sexual outcomes like gender-based violence, sexually transmitted infections, and so on. So are we ready to look at some words? And I'd like each of you to pick one word on this slide and tell us what it means. So Sola, if you could help me make sure that the microphone can pick up what people are saying, I would appreciate it. So if we'll just start on one side of the room and go all the way around, I'd appreciate that.
Yes, transgender simply means that you want to transfer your own anatomy. Like if you're male, you have some characteristics that make you to want to change your sexuality. To be a female, you can change your sexuality to be a female. That means you're transforming your gender, simply.
Exactly.
And also, female also can transform her gender to come a male. Yes.
Excellent. Exactly. Transgender are people who...
Yes, somebody else.
Okay. Phil, hang on a second. Transgender people are people who feel like they were born in the wrong body. And so they want to be the other gender. Okay, next.
Birth control.
I'm sorry?
Birth control.
Birth control, yes. Okay, tell me about what is birth control?
Birth control. Okay, birth control is use of contraceptive to, you can regulate the number of children you need to have. You can have good spacing or you can, yeah.
Exactly, birth control.
You can have pregnancy at the wanted time. Yes.
Exactly. We use birth control a variety so that we can control how much space is between a child and when we have them. Excellent. Next person.
Other thing is rape.
Okay? Tell us what that is.
Yeah, it is actually forcing someone to have sex without asking the consent of the person.
Beautiful, beautiful, exactly. Okay, next person.
Yes, erection dysfunction. Erection dysfunction. That is
Okay,
inability to remain strong or being weak while trying to have sexual intercourse.
exactly. That's exactly right. Erection dysfunction is whenever a man is unable to maintain his erection, a hard penis when they're trying to have sex. Very good, beautiful. What next person?
I saw what polygamy.
Yes, tell us what polygamy is.
Is polygamy is marry more than one wife.
Exactly. Okay. Who's next? Beautiful. Thank you.
Ejaculation.
Yes, tell us what ejaculation is.
Ejaculation is the process of a man to release sperm or a man's cell.
Exactly. That's exactly right. That's exactly what it is. When a man releases sperm or semen. Exactly. What, take another word, somebody.
Condoms.
Condoms. Exactly. I know, we know what this is, but why don't you tell us anyway?
Condoms is used for protection, for sexual protection, in case so that sexual transmitted disease and for sicknesses as HIV and also for birth control.
Exactly right. Exactly right. It's a barrier method that is used. Usually we use male condoms that protect from sexually transmitted infections and can also work as birth control. Excellent. What's the next word? Thank you.
Have syphilis. Syphilis.
Okay. And what is that?
Is also one of sexual transmitted disease.
Yes,
Mostly we get through sex.
exactly.
One partner.
Exactly. Beautiful. It's
It
a
can
sex.
also be transmitted to babies.
Yes. Yes, exactly. It is a sexually transmitted infection and it can be transmitted by pregnant women to their babies. Excellent. Thank you. What's another word?
Vibrator.
Okay. Tell us what that means.
Yes, vibrator is simply this artificial penis that sometimes a woman can use or a lady can use.
Yes, a dildo. It is a it's something, it's a device that women or sometimes men, but
Yes.
usually women use to instead of a penis for sexual pleasure.
Yes.
Exactly. Good.
Yes.
We're getting into some tough words there too. That was a good one to pick. What else? Anybody else in there?
FGM.
Yes, FGM.
FGM.
Yes. And tell us what that is.
Female genital mutilation.
Yes. And you want to tell
Okay,
us
that one is circumcision of girls. Circumcision of girls.
yes. That's right.
Women's circumcision.
I'll just add women's
Women's
circumcision
circumcision.
that can result in removing of partial or whole clitoris.
That's right. That's exactly right. There's several different types, obviously you all know this, of FGM, and it can be as removing the very tip of the clitoris all the way to removing the entire vulva, the entire external genitalia. So you're exactly right. There's a lot of different types. Thank you. And next.
There's also abbreviation STDs abbreviation, which is stand for sexually transmitted disease. These are diseases which are spread through sexual intercourse.
Exactly right. That's exactly right. And sometimes also through oral sex as well. Many of them can be transmitted through oral sex as well. Excellent. Okay. Who's next?
Same sexual relationship.
Yes.
The same sex sexual relationship.
Okay. And tell us what that means.
Yeah, it means simply the gay and lesbians, when the same sex, the same people, or a man and a woman and a woman, a man and a man, have a relationship in sex based on their personal relation orientation.
Exactly. It's just what you've said, having sex with someone who's the same gender as you or same sex as you. Excellent. What else? Who's next?
Toys.
Okay. Tell us what that is.
Yeah. These children playing materials used in child-friendly spaces as means of psychosocial support to children.
Yes. Okay. Now let's see. Which word were you saying again?
Fallopian tube.
Oh, fallopian tube. Okay. And what is the fallopian tube?
That is that connect the uterus and the ovary.
Exactly. I want to go back to the person before you. Did you say role play?
He said toys.
Toys, yes.
Oh,
Yeah,
toys.
Children playing
Okay.
materials.
Okay, and you said it's things that children play with, but in this case, toys, we mean sexual toys, which could be a dildo.
Okay.
Other types of sex toys that are used within for sexual arousal, like I say, dildo, a vibrator, things like that. Okay, great. Thank you.
Yeah.
And the next person?
Of bestiality.
Bestiality. Who can tell us what bestiality means?
Yeah, bestiality. This is sexual relations between human being and a lower animal.
Exactly right. That's exactly right. Between human and an animal. Thank you. And next?
Heterosexual.
Heterosexual. What does that mean?
It means a sex between a man and a woman.
Exactly right. That's exactly right. Excellent. And next? Pardon?
Victim.
Okay. Licking?
Victim.
Oh, okay. And a victim. I'm sorry. Victim. And tell us, what is a victim? Tell us what a victim is.
Yeah, we have penis there. I've seen people.
Yeah, you are asking.
So victim is when a person is harmed as a result of accident, injury, and so on.
Exactly. A victim is somebody who's harmed. Exactly. Usually through no fault of their own. Okay. What was the next word?
Masturbation.
Masturbation. Tell us what masturbation is.
Masturbation is the act of arousing the sexual organs so that someone can reach the climax to release.
Exactly
Both male
right.
and female can masturbate.
That's exactly right.
Yes.
Yeah, we have penis.
We have a what?
We have penis.
Penis, okay. Tell us what a penis is.
Yes.
Yeah, it is one of penis is the tool used to it's one of the tools.
Yes. Hopefully used for
It is
good,
two
right?
letters now. Yeah. It is social organ, but I know, but it is a tool now connecting intercourse.
That's exactly right. It's the male sexual organ. It's the male sexual organ used in intercourse, and also it is used to urinate.
Yes.
Okay, next word.
Ejaculation.
Sorry.
You already did ejaculation, but you could do it again.
It was
I didn't mean it like that.
not there. Already done.
Okay, so what is that?
Define it and what is that?
I'm sorry, what?
Huh? Okay. Ejaculation is release of sperm.
Yeah, that's what I'm sorry.
Right, exactly right. The reason of sperm and semen. Semen is the fluid that can be released even if the person has a vasectomy. Excellent. Okay, and next.
Yes.
Psychosexual. They have psychosexual.
Psychosexual. What does that mean?
This means the activities related to mental,
Fertility stuff.
emotional, and then a human behavior through sexual development.
Exactly right. Psychosexual is exactly that. It's about our psychological and sexual development. Exactly. Beautiful. And who's next? Anybody else, or have we done
We have
everybody?
infertility.
Oh, I'm sorry.
Testosterone. Testosterone.
Okay, and tell us what that means.
Testosterone is one of the hormones that is responsible for aiding and helping a man's reproductive systems.
Exactly. So we're talking about testosterone, right?
Yes.
Yes. Testosterone is the male hormone, and the testosterone, women have a little bit of it too, but not much. But the male hormone testosterone makes men have beards and bigger muscles and deeper voice, and it strikes at puberty. And that's when boys start changing, when the testosterone increases in their system. Very good. Excellent. I don't think there's any word on there that y'all don't know and aren't comfortable, and you're comfortable saying them all. That's great. And so who's next?
Abortion.
Yes. And tell us what an abortion is.
Abortion is stopping of unwanted child.
Exactly. Abortion is ending a pregnancy. It's not always it's not always unwanted, because sometimes there can be medical problems like an ectopic I can't say that, pregnancy. So yes, it is a termination of a pregnancy. I'm sorry, again. Next word. I couldn't hear.
Abstinence.
Abstinence. Let's talk about abstinence. What is abstinence?
Abstinence simply means that you can abstain from sexual relationship or unprotected sexual relationship, like you abstain from sex.
Exactly right. Exactly right. We simply abstain from having sex. Very good. And some people would say that's the only form of birth control. That's 100%. Next word.
Lubricant.
Lubricant. What is lubricant?
Lubricant, yes. The lubricant, these are the fluids produced during the sexual intercourse between a man and a woman.
Exactly. And we have our own natural lubricants. And then sometimes, because sometimes there can be difficulty maybe for a woman to lubricate naturally, sometimes we buy like a gel that can be used as a lubricant.
Yes.
But we have to make sure that it's not, I think it's oil-based. We want to make sure that it won't harm the condom if we're using a condom. Very good.
But by the way, it depends with the age.
That's exactly
It reduces the
right.
age.
And you want to talk about why that's true, why it depends upon age?
Yes, when you are aging, which means the lubricant is also reduced. The production of lubricant
hormones.
in the woman, by the way,
That's
may
exactly
reduce,
right.
and then will become very difficult in friction to cause a lot of pain.
That's exactly right. That's exactly right. Many times as women age, they don't produce as much natural lubricant as they did when they were younger. And so that's another time you might want to actually use an external lubricant, again, a gel, so that intercourse won't be painful for the woman. Great, thank you. Okay, is there anybody else still that hasn't done a word?
Yeah,
Okay,
sexual abuse.
sexual abuse. Tell us what that is.
Being someone,
Pardon?
forcing someone into sexual
That's
activities.
exactly right. Forcing someone into sexual activities, exactly right. And sexual abuse is usually broad enough that it isn't just intercourse. It could be touching or, other.
Use of pornography
Yeah,
or sexual related pictures.
that's right. It could be taking
Even
pictures.
use of sexual related pictures.
That's exactly right. Pornography. Exactly. There's a lot.
Pornography. Yeah.
Excellent. Okay. And next,
It's child marriage, yes.
child marriage.
It's,
Tell me what child marriage is.
Premature ejaculation.
Premature ejaculation. Tell us what premature ejaculation is.
Premature ejaculation is the state whereby the male will reach the climax before the other partner can reach the climax.
That's exactly right.
During sexual intercourse.
That's exactly right. Usually premature ejaculation it's not even just reaching orgasm before the woman, it's sooner than you want to. And so for men with premature ejaculation, sometimes they're unable to maintain an erection before they orgasm, sometimes just a few seconds, so it is, it's a problem that many young men have. It seems to not be as big of a problem as men get older and more experienced, but it is a problem that can be very embarrassing, even though it's just a natural thing and it can happen to anybody. Thank you. Next.
Ovulation?
Yes.
Ovulation.
Ovulation. So tell us what ovulation is.
Yes, it's referred to a period in women where they are fertile.
That's exactly right.
Where new eggs are released, and it occurs always after menstruation.
That's exactly right. In fact, we're going to look at that cycle, because for people who have a very standard cycle, menstrual cycle, then you can usually count the days, like you say, from the first day of your period until ovulation. But that is when a woman is fertile, when an egg is about to be released or is released. Excellent. What next?
Estrogen.
Estrogen. Tell us about estrogen.
This is the hormone of female, which is responsible for the process of activating the reproductive health, and also that's responsible for women to transform through the puberty processes, this hormone.
Exactly. Estrogen is the female hormone. It is also what makes us look a little bit different than men. Estrogen is what gives us breast and curvy hips, you know. So this, again, we get this whenever we reach puberty. And it is an important hormone that does decrease over our lifetime until we reach menopause. Thank you. And next?
You have chlamydia.
Chlamydia. Tell us about chlamydia.
Yes, this is a sexually transmitted disease caused by microorganisms.
Exactly right. Chlamydia is a sexually transmitted infection, and we're actually going to look at that later on today. But yes, it's a very common sexually transmitted infection. Thank you. Next.
Adultery.
Okay. And
Adultery.
tell us what adultery is.
Yes, making a relationship with somebody, wife, or an official married wife by someone, and making a relationship with her.
That's exactly right. Adultery is having a sexual relationship or outside of your marriage. Exactly. Thank you. And next.
Fallopian tube. Sorry.
Fallopian tube.
Did we say it already? Okay.
We did say that already, but you can still tell it to us again.
Yeah, fallopian tube. This is a tube whereby when during the sexual process, when the male ejaculates, this whereby the pregnancy, when the ovary comes, where the pregnancy takes place, then it will come back to uterus.
Yes, I was going to say we don't want the pregnancy to take place in the fallopian tube, but just the connection. That is the tube through which the egg comes.
Yeah, fertilization.
Exactly. Beautiful. Okay. How many more people do we have who haven't had a word?
I'm here.
Okay.
So I've seen scrotum.
Scrotum. So what is a scrotum?
It is the male sac that gives the testes.
That's exactly right. The scrotum is the sac, the skin in which the testes are located. So that's exactly right. Excellent. And is there anybody else?
Then I'm seeing also areola.
Okay. And what is that?
It is the dark or black point color that is found on the breast, on the female breast.
Ah, yes, the areola. It is, yes, the darker area around the nipple, surrounds the nipple of the breast.
Yeah, the nipple.
And male have areolas as well.
Very sensitive sexually.
That's right. They can be very sensitive, the areola and the nipple, and both men and women have that area and sensitivity. Okay. Who's next? Is there anybody else?
The word prostitution.
Prostitution. Tell us what prostitution is.
These are the practicing or activities of sexually for exchange of payment and all this.
Exactly right.
So
exactly right. It's a transaction for some type of sexual activity. And it's
yeah, sure, yeah, sexually.
Lacey, how are you?
good.
Yeah, survivor.
Survivor. So tell me what a survivor is.
Survivor is a victim of either sexual intercourse or any sort of abuse.
Mm-hmm. That's right. And as someone, we use this term survivor to be a more empowering term than victim. I mean, yes, somebody has been victimized, and we don't want to minimize that, but we talk about survivors as somebody who's come through the event and they're still here. So thank you. Thank you.
Okay, thank you. I'm leaving you because I'm on journey. I'm leaving you. I meet you again on 24th.
Oh, you're leaving?
Two coming training. I may not be around here.
Oh, okay. Who is that?
Yeah,
Is that
sorry
Dr. Saleh?
Yeah.
Okay, you won't be here. But will other people be there?
Yeah, I think the members will be attending with the exception of me.
Okay.
Yeah.
Okay.
I will join you
I know
again
that was
on
that's fine. That was a last minute addition, but the woman volunteered to do it on that Friday, which is a holiday here, but she was very gracious. So I know that was added after we set up the schedule. Are there, okay. Has everybody had a chance to describe a word?
Yes, Paul.
Okay. Which one? Okay. No more? Well,
consent.
Huh?
The word consent.
Consent. What does consent mean?
Consent is an agreement when you do the thing of which both of you are aware. Like for sexual intercourse, if both of you agree, then this an agreement.
That's exactly right. It's basically giving permission to something. Consent is permission to something, and in this context, we are meaning consent for sex. And does that mean that you actually ask your partner, "Can we have sex?" Sometimes, if you're married, you probably have signals between you that that can indicate that you're interested and she's interested. But it is making sure that the person is willing and able to say no, so that we don't force ourselves on somebody. Is there anybody else who hasn't had a word?
Penetration.
Penetration. So tell us what penetration is.
Penetration means the process of entering inside deep.
Entering?
Inside.
That's right.
Entering.
That's right. The penetration, if it wasn't related to sex, would be, like you say, entering inside something. When we talk about penetration in sex, we usually mean the penis penetrating the vagina, entering into the vagina.
Yes.
Obviously, it could be penetration. Sometimes when there's, sexual violence, sometimes other objects are used. Of course, even in consensual relationships, there might be toys or a dildo that's used for penetration. But typically, we're talking about fingers or a penis inserting the vagina, or it could also be the anus. Okay, who's next?
AIDS.
AIDS, yes. Tell us what AIDS is.
AIDS is one of the virus which can be caused by a virus called HIV.
Exactly
right.
Can
be transmitted through sexual relationship or through blood transfusions also. And through also fluids.
That's right.
Yes.
Exactly right. AIDS is acquired immunodeficiency disease.
Syndrome.
That's right. Thank you, syndrome. Thank you. And yeah, exactly. I forgot the S. And it does come from the virus HIV, and it can be transmitted through blood or bodily fluids, typically from intercourse. and from blood transfusion or sharing dirty needles for people who are injection drug users. You can even get them from tattoos too. If somebody has done a tattoo with a dirty needle, someone was infected. We see this for also the hepatitis C, which is something we didn't put up here, but yes. So anytime there's blood present, or there can be like there's an open sore, or there's mucous membrane, there can be a transmission of the virus. Okay. I'm gonna stop there if it's okay and move on. All right.
Yep.
Yeah.
Okay. So this is all about human sexuality, which is our experiences and our expressions of ourselves as sexual beings, obviously regulated by culture. And so, human sexuality, we may think of it as being primarily biological, but it also has to do with our emotions, our how we think about things. And so it's more than just that physical arousal, even though in animals, not humans, that is primarily what we think animals are responding to, is just the biological urges. But we don't have to have sex just for reproduction, which is when animals usually have sex. We can have sex for pleasure, to increase intimacy in our relationships. So I am going to start with biology and anatomy, And I'm going to show some drawings of the female genitalia first. And then we're going to go talk about body parts and their function, okay? So here comes the first one of a woman's genitalia. So who can tell me what the labia majora and the labia minora are? And what purpose they serve, maybe, if anybody wants to. Well, if a woman has not has not had her genitalia removed through female genital cutting or mutilation, she'll have labia majora, which is what we call kind of like the outer lips of the body. And then there's inner folds. The labia minora are these inner folds, which are sometimes a little bit darker than the labia majora. The one thing that a lot of women don't realize, even women who are very educated, is that we actually have three openings here. Obviously, we have the anus and we have the vagina, but right here, just right next to the vagina, is the urethra, and that's where we urinate. We don't urinate through the vagina. It's actually a separate opening, unlike men. So the urethra is the opening where we urinate, and then up here is where the clitoris is. What we know about the clitoris is that this little bump right here is much bigger internally, in that it actually ends up looking kind of like I don't really know how to describe it, but it has two kind of protrusions that are lean up against the vagina, I guess is the best way to say it. Obviously, this area is highly sensitive for women, and the clitoris is really the sexual organ that needs to be stimulated for women to become sexually aroused and to reach orgasm. That can be done through vaginal penetration or direct or indirect stimulation of the clitoris. There's a lot of nerve endings in the clitoris. And clitorises can be different sizes, as can the labia. They can be different sizes. Sometimes the labia minora comes outside of the labia majora. Sometimes it's tucked into the labia majora. but this will fill with blood, just like a man's penis fills with blood when they are aroused. Any questions about the basic anatomy here of the female genitalia? Okay. And obviously, go ahead.
No,
Okay.
It's very clear.
it's clear.
Okay. And then here's other view of the body, the woman's body. Obviously, right here is the vagina. This is the uterus. I'm using my cursor. I hope you can see. And this is the bladder and the urethra. So you can see they're very close to each other, but they are actually separate openings. Makes sense. And then of course, here's the rectum. That's just a side view. The vagina is lined with a mucous membrane. It's kind of with the lubrication or the wetness being determined by hormones, like we were just talking. And the mucus in the vagina increases whenever we're aroused, but as we talked already, it can decrease whenever we're getting older. When a woman ovulates, and this is, we'll get back into this more whenever we get to contraception. When a woman ovulates, her mucus becomes kind of like egg whites, stickier and clear, not before it's cooked, the egg white. So it becomes sticky and clear around the time of ovulation. The vagina is only about 3 inches in length normally, but obviously it can stretch and expand in length and in width. This is also where the woman's menstrual flow comes out, because the uterus shrugs off its lining and it will come out the vagina. And there are nerve endings right here at the opening of the vagina, but there's really not nerve endings inside the vagina. You know, many times when we talk about sexual intercourse, there's when we think about, for example, is the penis going to be the right size? Is it going to be too big or is it going to be too small? But the bottom line is this first kind of inch is the main area where there's sensation. And so it doesn't really matter, I mean, I would say, as far as being effective, the pleasure area is going to be right outside here or right at the edge of the vagina, and of course the clitoris. There are 2 glands, and I don't know if they're on here. No, I don't think they're in this picture. I'm going to go to another photo. So here's another view of the female sexual organs. And here's where we see the fallopian tubes much more clearly that we were talking about. Here's the ovaries, and here's the uterus. The fundus is the top of the uterus. And whenever a woman is pregnant, to see how many months she is, they measure from the fundus to see how many months pregnant she is. Each ovary is about the size of an almond nut, and the ovary has many different compartments called follicles, and that's where the egg is before it matures. And during ovulation, one of these follicles in the ovary will ripen, and it will be released into these little finger-like things are called fimbriae, and it will start its journey down the fallopian tube, hopefully at the same time, if we're wanting to get pregnant, that the sperm is coming up into the uterus to meet the egg. Let's see. If the woman does not get pregnant, then obviously this lining of the uterus sloughs off and becomes the menstrual period. There's 3 layers to the uterus. It has an inner lining, the endometrium, and sometimes you'll hear women have got endometriosis, which means that there's problems with the lining of the uterus showing up in other parts. And then there's a middle layer. This right here is called the myometrium, and that's kind of the muscle part of the uterus that helps push the baby out. And then there's the outer layer that is the perimetrium, this outside part here. The cervix is right here in the middle. So here's the vagina, and then there's a cervix. And the cervix is usually pretty closed, again, until it comes time for childbirth. It's not completely sealed because that is the way through which the sperm travel, and also the way, again, in which a woman will menstruate. Let's see. I'll go right here. This is, again, another normal uterus with the cervix right here. This is what you see, the fimbriae, and that is kind of the egg will go from there, kind of get sucked up into here, and then continue on, and you can see the lining a little bit better. For women, I'm going to talk about women's fertility cycle. Most women, but not all, the average woman, I guess they say, has a 28-day cycle. It can range, though, from 21 days to, certainly more than 28 days. It can go from into 30-something days. But on average, a woman's cycle is 28 days. And the first day is usually assigned to her menstrual period, just as the woman earlier said. The first day is day one, the first day we menstruate. Most women menstruate for about 5 days. Usually, it's kind of light on day one and the last day or so, but it'll be heavier in the middle of their period. Some women have a lot of pain with their periods and some don't. It's actually very cultural about how we respond to our menstruation. After our menstrual cycle, from days 6 to 12 or 13, this is when the egg is just starting to form again. And on day 14, which is halfway through the cycle, so this is about 9 days after the end of the period, finally the egg comes out of the follicle and is swept up into the fallopian tube. So if there's any sperm that are already present or that come in within the next 24 hours, it is a greater likelihood that the egg will be fertilized. Obviously, if it's not, then she menstruates again in 14 days. But if she is, then the fertilized egg implants itself into the uterine lining and a baby starts. And then we start I'm trying to say we start producing progesterone so that the body knows that we're pregnant. If a woman has a really regular cycle every 28 days, the other way, this is always hard, but it's you ovulate 14 days before day one of your period. But again, it's kind of hard to know unless you're actually regular with your menstruation when 14 days before your period ends. And we'll talk a little bit more about that when we get to contraception. This is basically just another view of the uterus. Here is the endometrial lining being sloughed off. Now, one of the things that we usually see, most girls used to get their period at around age 12. But we also see many girls starting their periods as young as 8. My daughter had her first period at 8. And some women don't start until, or girls don't start until they're older, about 15. One of the reasons that we now understand girls to be having their menstruation earlier has to do with when they reach a certain weight. So I'm trying to think how to translate this into kilograms. Let me think about this real quick. When a girl is, I'm going to do the math here real quick. When a girl is 2.2, about 45 kilos, she has enough fat in her body to produce estrogen that will start her menstruation. Most women continue to menstruate until they're like 45 to 55. And when we stop having our periods, it's called menopause. I know you all know that. And menopause is another part of our lives that how we respond to it is very much influenced by culture. Some women feel much more free once they're no longer menstruating and might actually enjoy sex more because there's no fear of pregnancy. Whereas other women may have, more challenges with menopause, hot flashes, and have a more difficult transition. One thing that we know is that the more times that a woman menstruates, the greater her risk of breast cancer. That means if a woman starts menstruating early and is never pregnant and continues to menstruate until, let's say, she's 50, she will have a greater risk of breast cancer than a girl that starts menstruating at 12 or 13 and has a couple of pregnancies along the way. And it's because of exposure to estrogen, to our hormones, that we have this increased likelihood. Not that there's anything we can do about when we start our periods or quit menstruating, but this is just kind of an FYI. And then whenever women are menstruating, we usually wear a pad, which is this, disposable cloth, or a tampon. But I understand in South Sudan, it may be very difficult in some areas to access store-bought or even afford store-bought pads. So people often use a cloth or skin, and some people don't actually even use, some girls don't use anything. And that may be because they are segregated during their period. How does it work there in your communities when a girl menstruates? Does she have access to pads, or are there other rituals that isolate her?
Yeah, they have pads.
They have pads.
Just
Okay.
asking about cultural, live about this.
Sometimes even traditional society, they might use clothes. Clothes is here.
They used to.
Okay.
Currently.
Okay. I heard somebody say sometimes.
I think mostly it's the urban based. Yeah, those in towns mostly use pads, and there are also some rewashable clothes that have been provided especially for rural girls. But in villages and especially nomadic communities, it might also be very different. Looking at their situation, they might be using pieces of cloth, for girls, So it really varies. Urban, rural, nomadic communities, which is characterized in context in South Sudan. On that, I heard that in the nomadic areas, when a female is having menstrual cycle, they have to go and sit in the tank. Then until that menstrual cycle stops, then to come out. I heard something. I don't know whether you heard that, Lacey. She was saying that in pastoral communities. So when a girl is menstruating, she is put in a place where there is the cow dung.
Yes,
Cow dung ash.
Yes.
So, and she stays there until the menstruation is finished.
Yes, I was actually reading about that. And it is, this many times. Go ahead.
Speak up.
Oh, I thought somebody was going to say something. Yeah. What I was going to say is that menstruation can be a barrier for girls going to school. Many, even in the United States, where, we kind of talk about everything, menstruation is still kind of a private issue. Now, we do now make sure that, or we're trying to make sure that women and girls have access to pads or tampons or some type of menstrual items so that they can continue their kind of activities of daily living without it interfering. But if a girl doesn't have access to, something to prevent her blood getting on her clothes or showing, she may not go to school. And so there's actually been a lot of emphasis, even globally, on trying to make sure that girls have access to menstrual products so that they can continue to participate. We do have to be careful with tampons. Tampons are inserted into the vagina and absorb the menstrual blood, but if they don't get taken out every 4 to 8 hours, it can cause toxic shock syndrome. So the one thing that we try to remember with girls is to remind them to change their tampons on a regular basis so that they don't get toxic shock. Also, there can be problems with menstruation. There can be amenorrhea. Amenorrhea is when we don't have a period. And that can actually happen for many reasons. When, for example, girls who have eating disorders like anorexia, where they intentionally don't eat because they think they're too fat and really they're very, very thin. When they get below a certain weight, again, right around that 45 kilos, they may stop menstruating. We see this with athletes sometimes female athletes who have so little fat in their body that they don't produce enough estrogen for them to menstruate. It usually reverses. We can also have dysmenorrhea, again, a very painful period. And sometimes we can have abnormal bleeding where there's just a really, really heavy flow. Sometimes that can be a sign that a woman might have endometrial problems, but if it's a regular occurrence. But menstruation is a normal process. All women usually are going to menstruate, and we want to make sure that our daughters or the girls know what's going to happen to them. Usually we start telling a girl ahead of time, or she learns from her mother or her sister, when you get to be about this age, you will start menstruating so that she knows what to expect and she knows what to do about it. If she starts menstruating when she's not at home. So we want to prepare girls, and we also would like to reduce any stigma. I know sometimes it depends upon the culture and the religion. Sometimes girls don't, like in Islam, they don't have to go to the mosque when they're menstruating. Some cultures, they don't want girls or women who are menstruating to touch certain items or cook and so on. Sometimes it's to give the woman a break whenever she's menstruating, and sometimes it's really more about the stigma. Any comments or thoughts about the menstruation and kind of how it's responded to in Juba or other communities besides what we've just said earlier?
I think for me, really, from UNICEF and also as a South Sudanese, I just want the participants to underscore the importance of this topic because they are going to be training social workers from the communities next year. And this is the reality that many girls in South, to me, is very, very critical. As a child protection specialist for the last 13 years, I haven't even gone through this training. So you can imagine how important it is for me. And I'm not even going to be involved in teaching social workers next year. but just underscoring how this is really important, because we know issues of menstruation keep courage in South Sudan. Yes. So this is one of probably the most important topics of these trainings, in my view. I don't know how others feel, but for me, it's really something that we need to take it seriously, and it's going to be very helpful for the case workers that are coming from rural parts of South Sudan to get this training from University of Juba next year. Thank you.
Yeah, to add on that also, from my previous experience when I was teaching separate adolescents and families in marriage curriculum, it was one of the challenges we face, because most are because of administration period. With this, we came in with the solution of providing pads for girls. Feel free when they are in the class attending the lesson. So this one is one of the most challenging situations.
I agree, and I think
from experience, I've trained also with UNESCO. The training also was on sexual education. We had the same program on sexual education, how to talk to the girls, how they can, when they have menstruation, what should they do? We bring people from the States. And you may find that some even of the participants about sex, how to clean themselves as mothers, sometimes they don't help them. These are some of the challenges that is there, but I hope through this training we can be able to support many things deep in the villages.
Yes.
Yeah, also to add on that, for me, I think if we happen to finish this training, I wish that it should be implemented in all the schools as awareness when first years come to school, or in any other places when they are first time they are coming, they should be alert. They should be given awareness that how to make themselves clean, and how to should be put on implementation for awareness program before the starting of schools.
I agree. Yes. Good points. Yes, these are all important points, and you're exactly right. We see girls not being able to go to school because of not having pads, and it is a very big issue, a very big barrier. And so I'm glad to hear that there's organizations out there providing pads to the girls, and it is also, as you mentioned, it's not just about wearing a pad or a tampon. It is about how to maintain hygiene during one's period. One of the things that, we need, there's some myths sometimes, like, you can't take a bath, but you should be taking a bath or shower on a regular basis while you're menstruating. And definitely making sure that vulva area is clean. Also, we don't need to, and I don't know if this is even a practice there, but we don't need to douche. Is that something that is practiced there, douching, using a hose to clean out the vagina?
There's a question anyway, but I want to say something before I put that question into place.
Okay.
Yeah, before the civilization, especially South Sudanese in general, it was recently people came and realized what we call civilization, and we start using parts and all this, like always. But before, they were not using it. But compared to the condition they are in as women today and before, those who were there before, you could not even get a lot of diseases like STDs. They were not common. But today they are using the same as cleaning, all this. But I've seen there are so many STDs are very common with the girl, whether they are even involved in sex or not. I don't know. Is it the fats or the always are the one causing all these diseases? Because they don't clean or what? Before all these diseases were not there.
Yeah.
What is the reason? What is the reason behind? And we are trying now today. We say this is the best way we have to go through it to protect the girl lives.
Yeah. Actually, we don't get the sexually transmitted infections. It's not related to menstruation, or when you say cleanliness, it depends on how you think of that word cleanliness. Usually, unfortunately, it was if you did not have sexually transmitted infections previously, and now you do, it's because somehow, just like with HIV, somebody has introduced it into the community. And usually women are more vulnerable to get an STI from a man than vice versa. Now, men can get sexually transmitted infections from women, obviously, but if you just think about the biology and the fact that the semen, the bodily fluid, is deposited into the vagina, it has a longer period to be able to be exposed to any infection that's included that's in the semen or that's on the penis. But again, not saying that men aren't infected by women, but probably again, just like with HIV, somebody brought the disease into the community. And many times we don't even know with some STIs that we even have an STI. And we're going to talk about that, but because there's no feeling, not many nerve endings inside the vagina, some of the and we don't urinate through the same tube that that where our vagina is two different tubes. We don't feel like a burning from urinating like a man might, where if the infection in a man's penis gets into that to the urethral tube, which is also where semen comes through, then they will feel like a burning when they urinate, because the urine is burning like the lining of that, because it's become infected. Because the penis has become infected. So a lot of times women don't even know. And so because we don't have the pain or the symptoms, and it may not be until we actually go for a physical and have blood taken that we find out that we have a sexually transmitted infection. So yeah, I would say that it is about somebody brought that infections into South Sudan. You could, I don't know who or how. Sometimes people leave, they get infected, and they come back. And probably because of a lack of detecting that infection, it was allowed to spread. Yeah. But it doesn't have anything to do with, changing use pads. Yeah, was there a question?
Okay, also, I have something to say.
Yeah.
About that, about sexual transmitted diseases.
Yes.
By then, but I think people are not actively sexually, because sometimes I think only female and male can meet only when they want to produce. They are not sexually active. But this current generation, they are sexually active. That's why even they make sex for what? For money. They become, you find places where women sell themselves so that they can get money. That's why these diseases increase because of that reason. Yeah. Thank you.
And on top of that, I want to add something.
Yeah.
Yeah. What now, because of education that we are giving in now, before sex it was closed, but now it is open. Because the training, people, the social media also is the one supporting it. Because people are watching some videos. Even the kids of 6 years knows how to go about it now. But before, you can never reach up to 20 years without seeing the lady even. But now it is very easy. You Google, then you want to enter to the space. So this technology is the one encouraging this technology, the current that we are in. But before, it is very hard when seeing people talking about the sex to mention some name, some word related to the sex. It was very hard.
Yes.
When there was introduction, when you are getting married, you have to be given coaching. Before there was a coaching, but now there's no coaching.
Oh.
Just entered in the morning, then already you are expert at the evening. So these are how things are.
And for that issue, the issue of what girls are using for cleaning themselves. It's okay. Let's go.
No, it's
okay. What women are using, I think the simplest thing is just washing. When you go, usually we tell our children, the young one, when you go to toilet or urinate, you have to wash yourself. And also apply to a big woman, she has to wash herself regularly and change those are dirty pants. And then I think that is the only thing, only washing with water.
Exactly right. That's all we need to do. The external genitalia. We don't need to do any washing of the internal, your vagina. We just need to wash the external genitalia, just like we would, after we urinate or have defecate, we would use water usually to clean. That's all we have to do with our menstrual cycle. The one thing, I'm going to go back to the STI question. I think one of the things, it is true that our children are getting a lot of information online. Unfortunately, a lot of times it's wrong. We have a lot of myths sometimes we have to push back against. Like one of the myths that we used to see is that you can't get pregnant the first time you have sex. Well, you can. One is some people even think if you just kiss somebody, you can get pregnant. And of course, you can't. So a lot of times the information is not very good online. And one of the things that I think is most important is to impress upon anyone who's sexually active to use condoms, because that's one of the best ways to prevent transmission of sexually transmitted infections. And many times sex prostitutes or sex workers are pressured to not use a condom. The customer doesn't want to use a condom. And because, sex workers, prostitutes are usually doing it because they really need money, they may take, they may have, in fact, do have sex without protection, because that's the only way they can make money. We have to get men and women to always use condoms. And many times we feel like we can't use them with our spouse, but we can use, condoms with our spouse, again, as a form of birth control. It doesn't mean that we're, out having sex with somebody else, but it is a way of, again, spacing out children and protecting ourselves from sexually transmitted infections. My understanding is that many times there's an objection to using condoms within the marriage. But if the husband is having sex outside of the marriage, then there's a risk that it will be or the wife, either one, that it'll be transmitted to their partner. And so maybe that's why people don't want to use them. They don't want to seem as though they're suggesting they've had sex outside of marriage. But again, they can still be used for, for child spacing and contraception. But that our young children often don't want to use condoms. I think that we know what we've seen globally is the more correct knowledge that kids have about human sexuality, the lower the rates are of them getting pregnant outside of marriage. We've learned that abstinence-only education, at least in the United States, people may delay sex, but then they tend to not use, again, condoms or other means to protect from pregnancy or sexually transmitted infections. Yes, so menstruation is a very big concern, an issue for girls and women to make sure they're able to care for themselves, have pads so that they can continue on with their activities. I think I read somewhere that there was a belief too that if women did not, or girls didn't, you mentioned the cow dung, Ash, that if they didn't stay there for their first menstruation, that they would never menstruate again. But, you know, normally when a girl starts menstruating, except in the very first, you know, she may have one period if she's very young and then not have a period for a few months, but she will eventually menstruate again. So there are, you know, there are some myths like that. I mean, there's also a myth I heard about that one reason, this was in Egypt, that people were doing FGM is they were worried that the clitoris would grow into a penis. And it's like, that doesn't happen. But there are clitorises that can be not big, but that can be a little, they can be different sizes. And so, you know, we don't need to worry about some things like that. I don't think I need to do that. This is just ovulation. This is just showing those follicles. Yes.
The question, yeah.
Not a question, but there's also something about the sexual transmitted diseases. There's also a concern of using public latrines, and because of our biological difference between men, for women we are open. Then the issues of public latrines, where you go with squat, and it's easy also to get.
Yeah.
And that's what I was expected even for her to tell us. And that's what is the reason why women are getting all these STDI because of these common urinaries. This is where the problem came in. But before, when we were outside in a common place, everybody can go to bush. You may find there's nothing called those STIs, and all the women were really free. But the common place, because we are very far, you know, the fever when the woman, because you are down, by the way, so the fever start, and all the bacteria and the virus immediately goes up through the waffle, and then they caught up with the body part of the woman, and that's why it is common today.
Yes.
And some other places, like even you go to Kenya or Uganda, women they do also urinate like a man because they don't trust that area. That is common.
You're talking the toilets?
Yeah. Yes.
Yeah.
Public. I don't mean toilet. Public toilets.
Oh, okay. Okay. Public tiles. Okay. You are right. Anatomy has given us women anatomy that makes us very vulnerable to being able to be infected because of, like you say, the way our vagina and the urethra, everything is created, and usually the woman is receiving the semen and sperm, which makes it, you know, it's going to be in her body longer, much more likely to cause an infection. Ovulation, we've already talked about that. It kind of happens on day 14 of counting your first day of your period. This right here, this primary follicle is kind of, these are all over the ovary, but it starts growing. And here's, you know, this is just a diagram of the egg fertilizing, leaving the ovary. And then this is the empty follicle where the corpus luteum kind of goes back into itself. This is what I was talking about again on ovulation. This fluid that you can see between her fingers is kind of like, again, they call it kind of like egg white cervical mucus. It's kind of clear, it's stretchy, and it's less acidic, because at other times of the month, the mucus can be much thicker, and it would, in the vagina, it would actually, and acidic, and it would actually stop the semen from, or the sperm from being able to make it all the way up to the fallopian tubes. But when it's ovulation time, the woman's mucus changes. and that allows for the sperm to move on through up to the fallopian tubes. You know, many girls don't understand the different discharges that they might have from their bodies. But as long as a discharge from the vagina is clear, it's usually quite normal, you know, to have a clear discharge that might get thicker during some parts of the year. It's when we get into different colors of discharge that we is likely to indicate a sexually transmitted infection or something. So anyway, this kind of mucus allows the sperm to travel easily up the vagina into the uterus. And let's see, I guess you already know this, but each month only one ovary releases an egg. It goes back and forth, you know, usually from the left side to the right side. Yeah, I think that's all I need to say. Sometimes, you know, again, women can end up with sexually transmitted infections that scar the tubes. And so they, even though they are not aware, they basically have had almost like a tubal ligation because they didn't mean to, but the scar tissue has blocked their tubes and they can't get pregnant. This is the cervix, looking from the vagina up to the cervix. You can see that there's a tiny little opening there that is, again, so that semen and sperm can come into the uterus and menstrual flow can come out. Again, here's the vagina, the cervix is right here. And when we are going to have a baby, again, we start kind of looking like this, but the cervix becomes thinner, and then it starts opening up so the baby can come through. We can be completely, the cervix will become thinner and it will open up to about 10 centimeters. Are there any, you know, I think this is a good time to take a quick break. I think we've been going about a little over an hour, and we are going to move to the male reproductive system next. And since I see I've only got, let's see, I've only got another hour, I might speed us up through this a little bit. So why don't we take 10 minutes and then we'll come back and continue. Is that okay? Excellent. Well, as you can see, we are now going to move on to the male reproductive system. I am going to move us a little faster so we can get some additional material. But here is a side view of the male reproductive system. This here, if you can follow my cursor, this is the penis. This yellow part is actually the scrotum, which is the sac that the testes or gonad sits in. This is the rectum, and this would be the pelvic bone and the your backbone. There's muscles that can actually excuse me, there's muscles attached to the scrotum that can make it raise and lower, bring the testes closer to the body, or let it be more loose from the body to regulate the temperature. Because you don't want, sperm doesn't want to be too hot or too cold, or it won't be, the sperm won't be produced. Here's another vision of it. Of course, again, unlike the female system, which we've already talked about, the bladder and the urine go through the very same tube that the sperm and semen come through. Again, here you have your testes right here. This little bluish purple thing is the prostate. The prostate can cause problems in some men, and this is why there's a regular exam for men to make sure that the prostate isn't enlarged, which can make it more difficult to urinate. Sometimes there's cancers of the prostate that most of them are pretty slow growing, but sometimes men will have the prostate removed, or they may have radiation seeding done there, which can then make it difficult for a man to get an erection. So many men who've had their prostates removed will then use something like Viagra to be able to get an erection and have sex. It doesn't mean the end of sex just because you have your prostate removed. These Cowper's glands right here, they actually add a little bit of fluid to a little bit of lubrication as to the when the man is ejaculated, to the semen and the sperm. This is just another, look at it. Here's the testicle. And again, the semen comes up here. This tube is called the vas deferens right here. And again, it will then be ejaculated. Let's see if there's anything else I want to say. Yeah, this coiled tube here is actually where the sperm matures. And just so you know. And here, let's see, the tubes, these vas deferens tubes, they are referred to sometimes as the spermatic cord or the spermatic tube. This is again where the sperm comes through. It's about 30 centimeters long, and it's protected by smooth muscles. Again, when a man is ejaculating, these muscles will contract reflexively so that the ejaculate is, able to be pushed out. Let's see here. So this is another side view of the male reproductive organs. Again, we see here is the bladder. Right down here, this right here is the penis, and the back here is the rectum. So we're looking, the front is up here. This is how a doctor does a rectal exam to determine whether or not the prostate is enlarged or not. Usually this is very, men are often very uncomfortable getting this prostate exam, but again, it is important to make sure that the prostate is functioning properly and has not become you don't have cancer or something like that. The prostate does secrete a milky substance that is made up of about 20 to 30% semen. And again, it is the prostate can be infected with a number, or can be affected by a number of disorders like swelling, inflammation. And so again, this is how a doctor checks, is by inserting his finger into the rectum and feeling the prostate right here. It is also a way that a man will ejaculate if you're having sex and the prostate is tickled through anal penetration. That can cause a man to almost immediately ejaculate. Let's see, I've already talked about these Cowper's glands. They have ducts that lead to the urethra. They produce a few drops of mucus kind of fluid. It's called pre-ejaculate. Many times, again, it provides some lubrication to the penis prior to penetration. And it also helps this liquid that comes from the Cowper's gland also helps neutralize any acid in the urethra, so that the sperm, kind of cleans out this tube so that the sperm can travel better. Okay, so there's 3 chambers that make up the penis. There is, what happens when a man is not excited, his penis normally it hangs flaccid, is what we call it. It's kind of soft and limp, but that's called flaccid. And as a man gets aroused, the brain tells the muscles around the penis the muscles actually relax and allow blood to flow into the erectile material, this kind of spongy erectile tissue, and that then the blood creates this pressure that then allows the penis to become erect. At birth, there is a foreskin attached down here at the head of the penis. Sometimes people, in many cultures, men are circumcised at birth to have that foreskin removed. And is that a practice in South Sudan? Are men circumcised?
Yeah.
Yes, but certain regions, no?
Yeah.
Country.
Hmm?
Certain parts of the country.
It become a common thing nowadays.
Yeah,
Okay.
Even at home.
Yeah.
It's become a
Becoming
university.
more common. Okay. So,
Yeah, common everywhere.
okay. And so,
Yeah,
again,
the thing of it,
okay, at birth,
yeah,
usually.
the
Okay.
thing of it,
And this is, again, this is a common practice in many parts of the world.
okay, yeah, hello?
Yeah? Can you hear me?
Right. Yeah, this is
Yeah, the thing of this
concession.
circumcision as a control, they thought it is like when a person is circumcised, it reduces the infection,
The risk, yeah.
the risk of infection.
And actually, that's
So it's a thing all over the world. People are now circumcised.
you're exactly right. It has been shown that there's a higher rate of sexually transmitted infections if a man is not circumcised. But if a person is going to be circumcised, there's a couple of things. One, you want to make sure it's done properly with sterile equipment. Unfortunately, a botched circumcision can actually cause the penis to be it can actually end up being almost like amputated if from a circumcision gone wrong, if it becomes infected. And so actually the first penis transplant was done on the continent of Africa. And it was the man had lost his penis because of a botched circumcision. And he actually, again, this was a couple of years ago, the very first penis transplant. And it says that it's working now.
That can be crazy, yeah?
Okay.
Of course, this end of the penis is very the base is the glands. So this is the penis, the end of the penis, the glands area, the ridge is called the corona. This is a very sensitive area with a lot of nerve endings. And also, and one reason that some people, whenever the foreskin is removed, there's a less likely for a smegma, which is kind of like lubricant that can get kind of nasty in there. So if a man is not circumcised, he needs to be sure that with his hygiene that he pulls the foreskin back in order to clean underneath the foreskin so that there's no accumulation of lubricant, which is just, it's just a hygiene issue. Here we go. Here's the male reproductive system. This is, of course, the sperm running to meet the egg. They kind of look like these little tadpoles with tails. And what we know is that that there's some sperm that swim faster and some that actually live longer. And one is related to the likelihood of having a male child versus a female child. Of course, men can have difficulties with their sperm count. Sometimes men have low sperm count because of exposure to toxins. Sometimes, using drugs can also reduce the amount of sperm or make the sperm unhealthy. But about 100 million sperm are deposited during each intercourse. So there's a lot of sperm there looking for that one little egg. Again, you see here, there's a picture of the sperm, and it begins right here in the testes, comes all the way around and is ejaculated through the penis. Even alcohol and cigarettes can affect the quality of one's sperm. and make the tails not move, swim correctly, and so on. Trying to think if there's anything else that I want to say about the male reproductive system. I will say that even though we don't talk about men having a monthly cycle or menopause, men's testosterone does tend to drop off around their 40s. And so sometimes this actually can also be connected with a reduction in aggression when men get into their 40s, if there was any aggression before. But again, it doesn't mean that just because they have a little less testosterone that they can't, be sexually active and have a fulfilling sex life. I'm going to move right on into, since we're kind of starting with contraception right there, all we need is one little sperm to penetrate that egg. And here you see a bunch of sperm on this egg trying to get in. Finally, this little sperm here has made it into the egg. And so now that's considered, that's conception. That's the moment of conception. And once the egg takes that sperm, no other sperm can get in. So that is, and this is where it determines whether or not the baby's going to be a boy or a girl. We know that there are X and Y chromosomes. If it's the men carry Y chromosomes and women carry X chromosomes. So if it's an X chromosome in that sperm, then it will be a girl. And if the sperm has a Y chromosome, it will be a boy. Sometimes the egg will split itself, and this is when we end up with identical twins. And sometimes, even though there's sometimes more than one egg, a woman may ovulate with more than one egg, and that can result in twins that are not identical. So this is the moment that determines whether or not a child is going to be a boy or a girl. And there's a lot of knowledge out there about in reproductive health about how to, about what factors, acidity, alkalinity impact the sperm and conception rates. Here we go. Again, here's the ovary has released the egg. It's fertilized, it becomes a zygote, it splits, and when it gets to about day 7, hopefully by then the cells have, the embryo has implanted itself in the uterus and not in the tube. If the egg implants itself in the tube, it will not be a viable pregnancy. It could burst and kill the woman. So I still can't say that word, ectopic pregnancies have to be terminated.
Yeah.
Was there a question? So this is simply the egg, the zygote, now called a blastocyst. It's come into the uterus, and it's going to burrow into the endometrial lining, because all the first after the period, that's one of the things that the body starts doing, is building up the endometrial lining, which will nourish this new blastocyst. And oops, I went the wrong way. Obviously, if the blastocyst is implanted, there will not be menstruation. And there will actually be the lining of the uterus is going to get thicker, and the cervix is going to get sealed by a mucus plug. When the baby's about to be born, then that mucus plug will be basically, I guess, release would be the right thing to say. And then, your body hormones kind of impact on the rest of your body. And we can do a blood test and see if there's this HCG hormone to let us know that a woman is pregnant. That's usually done by a blood test or a urine test. So if we don't want to get pregnant, there are several ways. So let's talk about the only way to 100% not get pregnant is to not have intercourse, vaginal intercourse. But there's other ways to protect oneself from pregnancy so that we can space children out so we don't have them right on top of each other. And who knows about the basal body temperature method? You might know about that form of birth control. So this is considered a natural method. Basically, what a woman does is she takes her temperature every day before getting out of bed. And there's special thermometers to measure the basal body temperature. You take the temperature either vaginally or rectally, but whichever you do, you have to do it the same way every day. And then there's usually not much change in temperature, less than 1 degree during ovulation. But then there's 2 or 3 days when the body temperature rises, when it gets hotter, and that's usually when ovulation is occurring. So it kind of keeps going along normal, same temperature, and then all of a sudden it gets increased. And if you don't want to get pregnant, then you avoid having sex in the day before you would ovulate, and also for the next 2 or 3 days after you ovulate, because again, there are sperm that are going to go fast that could get there quickly before you ovulate and be ready. Or if you ovulate, there are also, it takes a few days for it to move through the fallopian tubes. And so that gives the sperm, if you have sex a couple of days later, opportunity to still be implanted. So you should not have unprotected sex during the time of ovulation, so that if you don't want to get pregnant. But it's not terribly reliable because there's a lot of things that can impact one's body temperature. But it is still a method that people use. It's not that different from what we call the rhythm method. The rhythm method is actually about based upon your menstrual cycle. Again, here's that kind of sticky discharge that kind of indicates that we are ovulating. But the idea is to chart one's menstrual cycle and, again, not have sex during the kind of the 3 days around ovulation. So if one has your period, day 1 to 5, and then, again, if you're regular, days 6 to 12 are safe. But then on days 13, 14, 15 is kind of when you're ovulating, don't have unprotected sex. And then you go through the rest of your cycle. So it's just avoiding having sex during the days you're most likely to ovulate. But again, high fail rate, mainly because women who don't have regular periods is really difficult to figure out. And just, miscalculation, human error, and so on. But again, checking the mucus, like shown here in the slide, can also help us know whether or not we're ovulating. So these are kind of 2 natural methods of contraception. I will say I used the rhythm method for many years successfully. So it can be done if one has a regular cycle. There's also hormones, Depo-Provera, which is a shot that is given that lasts a few months. We have our birth control pills that are taken every day. We have the patch, which again you put on, and it is worn, usually on the buttocks or the shoulder, and it releases hormones on a regular basis. Again, you wear it for a longer period of time. You wear it longer period of time than like taking pills every day. This little toothpick thing is another type of, it's an implant, and it usually will release progesterone for almost 3 years. And there's a very low failure rate for these implants. And also prevent women from menstruating, which can again reduce long-term possibilities of cancer. And then there's the cervical ring. And this basically goes inside of the, up around the, inserted into the vagina, and is removed whenever you want to have sex. but it has been releasing hormones that will cause your body to not, to not be able to have the lining ready for embryo to be implanted. Let's see. Are any of these hormone methods used in South Sudan? Or is birth control taboo?
Yes, they're all there.
All here, okay.
Only exception of that temperature, which I do not know. This is my time to know, but the other natural methods, they're all there, and the use of these hormonal methods are also there.
Okay.
And in addition to the natural one, also people who are using the withdrawal method.
Yes. Thank you for bringing that up. Thank you. Yes, the withdrawal method. What that means is that a man withdraws his penis from the vagina before he reaches orgasm and ejaculates. The problem with that is we talked a minute ago about this little bit of semen that might come out in the beginning to kind of lubricate. And that has sperm in it. So you can still get pregnant because of that pre-ejaculate semen.
Relation.
Yeah.
Which one? Withdrawal method?
Yes.
I have a question here.
Yes.
Welcome.
Yeah. Yes.
Yeah, I just want to ask about the uses of the contraception, especially for women, because in Juba here, commonly even young girls, school girls,
are using
upper primary, the schools, they are found to be also using that, and also women, and most of the women use the contraception even sometimes without the consent of the partner or the husband, and at the end, the husband needs a child, and when they want a child, the child doesn't come. So I would like to know the effect of this contraception. Are they really 100%? For example, if someone doesn't want to have a child for a period of 5 years, and then you spend these 5 years, and then will it really after 5 years then be exactly that you will have a child after that period of time? Thank you.
That's an excellent question about having a child after being on some type of birth control. And so typically no method is 100%. That's just the bottom line. Probably the most effective one is this long-term implant right here that lasts about 3 years. And they will tell you, most doctors will tell you, when you have that, when you quit taking these hormones, no matter which style you're using, you should actually not try to get pregnant in the first month or two. Wait a couple of months so that the hormones have cleared your system. And then you should be back to menstruating on a regular basis, and you should be able to get pregnant. Now, sometimes it turns out that there was actually fertility problems to begin with that we didn't know about when somebody started on birth control. And so then when they stop the birth control, that fertility problem is still there, and they may not realize that, again, that they had it, but that they had a fertility problem. But most women are able to take these hormones. Some women have negative reactions to them, but most women can take them and then stop and have their fertility intact when they want to have a child. That's kind of the beauty of some of these longer term methods, is that you can stop using them, and then within a couple months, your fertility should return to normal. Yeah. Does that answer your question?
Yes.
You also brought up a very important issue. And the reason, obviously, that we're going through this is because you're going to be training the people in the community who are going to be talking to boys and girls about this information. And so they need to be properly educated. But one of the warnings I was given, I was preparing for this, was that we might want to think about, because I think it could end up resulting in a bad situation if a woman is secretly using contraception without her husband knowing, it could lead to violence. And so one of the things that has been talked about in community work around this is to try to the degree possible to make sure we include husbands in these decisions, that we talk about child spacing and so on, so that we don't put the woman at risk. I mean, it's her decision, but this is my understanding is in South Sudan, it's much more of a husband and wife decision rather than just the wife. So to the degree that we can encourage men to be involved and be open, we want to do that. And we want to change the attitudes about using birth control and contraception. So that men can be comfortable with it. I mean, obviously, most of it's going to be used by women because we're the ones who are going to end up pregnant. But condoms are another example of we rely on men to be willing to wear condoms. But yes, usually, again, going back to the original question, we can our fertility will return to normal after we quit taking different hormones. There is some problems that women who are older than 35, or if they've had breast cancer, or if they smoke, they might not want you to take the pill because, again, it can increase your, some of these methods could increase your risk of cancer. So they sometimes have pills that just have progesterone only rather than estrogen and progesterone. Then, of course, we all know about barrier methods. This is our typical condom, latex condom, and you can get condoms that are not made of latex for people who are sensitive to latex. As this shows, it is rolled onto the penis, pinching the end of the condom so that there's a reservoir for the sperm, the semen. There's also a female condom, which actually, they're more expensive here anyway. And they are inserted. It's like 2 rings, a ring at each end, and this kind of latex in between. It goes all the way up inside the vagina, and it will actually fold over the vulva some to provide some protection, because obviously not everything is happening in the vagina. There could be herpes passed, from the testicles, from the scrotum, rather not the testicles, from the scrotum to the vulva area. We also have like sponges. Often these have spermicide in them, and they are inserted up near the cervix to block the sperm from coming in. This is a cup here. And again, you put spermicide in it and you cover the cervix. And that's the same thing here with the cervical cap. It goes up here to cover the cervix so that sperm can't get into the uterus. So we have diaphragms. They're not as popular as they used to be. That's another method. The cervical cap is a little smaller than diaphragm is actually, can be, a couple, 3 inches wide, several centimeters wide. They do have to be fitted diaphragms, because they come in different sizes, as do condoms. Condoms come in different sizes. And so condoms have a high failure rate, unfortunately, but usually it's because they were used incorrectly, or they were used with, if you use an oil-based lubricant, it'll break the condom just like that. So let's see. And then the last, I think this is, oh no, this isn't the last. These are IUDs. These are inserted into the uterus, and they kind of disrupt the environment there so that it's not suitable for implantation of a fertilized egg. And these can actually stay in for several years, but they do and they're like 99% effective. Because again, it doesn't, the endometrius is just, the uterus is not a place that the egg can implant when that IUD is in there. And then this one, Plan B, this is kind of what we call the morning after pill. If you've had unprotected sex, a woman can take this Plan B, which is basically just several birth control pills that will, again, make the uterus lining not favorable for the implantation of embryo. It's not an abortion. This is not the abortion pill at all. This is just to change the hormones and the lining of the uterus so that the embryo doesn't want to implant. It's not a regular birth control method. The abortion pill is something that you can usually take through a doctor, usually under doctor supervision, although there are places where you can have them mailed. That will terminate a pregnancy, but it has to be within a certain amount of time. And then finally, we have sterilization. A woman can have her tubes tied, and here's an example of where they've kind of made a little loop and they've put a band around it. They can cauterize it, and that way no longer can the egg come down the fallopian tubes. A woman will still have the hormones that she needs because she still has her ovaries, but she just won't get pregnant. This is another method that I had never even heard of. And this is when they put this Assure sterilization. They put a little threaded tube in there in the fallopian tubes so that the egg can't make it past this space to get into the uterus. And then finally, I know you know about vasectomies, and all a vasectomy does is just take a little clip of the vas deferens tube, which is what delivers the semen. And then the man will still ejaculate. It just won't have sperm. It'll be just the semen itself without sperm. Usually, vasectomy is less invasive than doing tubal ligation. And of course, sometimes, if there's other problems, a woman might have a hysterectomy and even have her uterus removed. But usually that's only done if there's, like endometriosis or something like that. I am going to talk about intercourse. I bet, because again, this is something you're going to have to be able to help the community workers be able to talk to, people in the community about. And again, a lot of times what I've noticed is that people will watch pornography and think that that shows them how they should have sex. And really, it's not how you should have sex. Most porn is totally done for certain fantasies and isn't really how women, at least, are interested in having sex. Usually, we want to have sex with somebody that we are married to or in a relationship that we care about. Coitus or intercourse is the penetration of the vagina with the penis. If you're trying to have a baby, this is when, the possibility of getting pregnant is once a man ejaculates. But there's a lot that goes into having sex that's not just, penis and vagina, orgasm, and we're done. There's something called foreplay. And that's whenever we are, before we have penetration, we are, usually kissing and touching and doing things like this to increase our excitement and our arousal. Johnson & Johnson talk about 4 stages of sex. One is the excitement phase, again, where you're starting to, be aroused. This could take a few minutes to several hours. During this time, the muscle tension increases, your heart rate races, your skin might become a little flush, like a little red blotches on them. Nipples become hard and erect, and the blood is flowing to the genitals, resulting in the woman's clitoris swelling and the erection of the man's penis. Vaginal lubrication starts, and the woman's breasts can even become fuller, and the vaginal walls start to swell. The man's testicles also start to swell. His scrotum tightens, and he begins secreting this pre-ejaculate lubrication that we talked about. If a woman is not having problems with lubrication, a sign that a woman is ready for intercourse is connected to how lubricated she is. If there's not lubrication, then penetration is going to be painful. But if a woman is lubricated, that means that she is without external lubrication, just naturally lubricated, then that tends to mean that she's ready and receptive to intercourse. The plateau phase goes from that arousal all the way up to the brink of orgasm. And so again, we're still seeing, blood flowing to the genitalias, our heart rate, getting more rapid. We might start getting muscle spasms in our feet, our hands, and then orgasm. And this is kind of like the climax of the sexual cycle. It's actually the shortest phase. A man ejaculates in just a few seconds. And a woman can actually have multiple orgasms if she's stimulated in the right way. But she also, again, most orgasms will be, a few seconds. And it's kind of like this release of tension. The muscles of the vagina will actually contract. A man can feel that if he still has his penis in the woman. He can feel the contractions. And again, sometimes people get a little flushed. And then finally, it's the resolution phase. And this is usually when the penis goes back to a flaccid, limp state. All of your, swelling parts stop swelling. Some women and younger men are capable of going right back to, being aroused and having orgasm. But most of the time, again, your average man needs some time called the refractory period before they're able to get an erection and reach orgasm, at least. And it just varies. The older men are, the longer that refractory period might be. Any questions or comments at this point?
Yeah, I just want to ask a question.
Sure.
About what about these men who have one testis?
Yes, actually, one testis. That's a very good question. One testis is still enough to be able to produce adequate semen or sperm and get a woman pregnant. That usually does not interfere with fertility. Because again, the man is ejaculating like 100 million sperm, but one testis should not impact that unless there was some, biological reason that he lost his first testicle, but he might have lost a testicle to cancer and still have another completely healthy functioning testicle.
Yeah. Okay, there's another question.
Yep.
Yeah, so like there. What do you say about some of the women that sometimes they are raped, and this foreplay sometimes not there, but at the end of the day, these women that are raped, they get pregnant. So how is that possible without the foreplay that you were talking about?
Well, foreplay is not necessary to get pregnant. Foreplay just means that the woman and the man are doing things to get more aroused. Men and women are aroused differently, and it usually takes women longer to get to a point where they're ready for intercourse. Men often are stimulated visually. For women, it can be very emotional. I'm going to tell you just a little joke. Somebody told me that the foreplay for women begins as soon as sex ends. And one type of foreplay could be a man doing cleaning the house. Could be arousing for a woman because she's feeling valued. Not that she's going to get sexually aroused, but it can give her good feelings towards the man. But a woman does not have to be aroused. She can still be raped, which is why many times there will be tears in the vagina from a rape because she was not lubricated. Or the other thing you need to realize is that our bodies also react. So a woman could be raped and even still have an orgasm during that rape because the right parts are being touched, even though she is not consenting and she does not want to have, she's being forced, but her body might still have an orgasm. That doesn't happen a lot, but it definitely, nothing about foreplay has anything to do with preventing someone from getting pregnant from rape. Does that make sense?
Yeah.
Are y'all
You
ready?
agree?
Yeah.
I have another
Yes.
question.
Yeah.
Usually they say a woman can get to the point at the second round or third round.
Yeah.
Third
Yes.
round, fourth round.
Yeah,
Yeah.
yeah. So they will not get their orgasm unless 2 to 3 rounds. But for men, they're faster.
Yes.
You get caught only with the vision, the seeing only.
Because there can be a lot of reasons why women don't reach orgasm, and if it's a woman who still has her clitoris, it has not been removed from circumcision, then if a woman still has her clitoris, she should be able to reach orgasm. But and again, this might be offensive, but I even told my daughter this, so it's not something that I wouldn't say, but many times, I'm just going to put it out here, many times men they've learned how to masturbate simply because the penis is right there and they can reach it and it's easy to masturbate when they're younger. But many times women don't know even how to masturbate themselves to orgasm. And to me, if a woman doesn't know how to reach orgasm through masturbation, it can be very difficult to teach her how to reach orgasm with a man. Because again, penetration is usually not what brings a woman to orgasm. It is, unless during that penetration, sometimes the clitoris might rub up against the man's pelvic bone. And when the clitoris is rubbing up against the pelvic bone, then that can cause a orgasm. But you're right. And certainly if a woman does not have her clitoris anymore, then reaching orgasm could be because usually it's the outside part of the clitoris that's been removed. It can be very difficult for women to reach orgasm if they don't have a clitoris, because that is the primary source of stimulation. Although again, it does go all the way into the front of the vagina. It's up against the front of the vagina, so you can still have orgasm. It's just not as easy. But yeah, typically women take much longer to get to the to be aroused. It's if you're having 2 or 3 minutes worth of foreplay, that's probably not going to be enough for most women. Which is why when you say it takes 2 or 3 rounds before a woman has orgasm, is because she hasn't been properly stimulated yet. Usually, unfortunately. It is that's why I think all couples should have sex counseling before they get married, so they can learn how to talk about sex with each other, what feels good, what doesn't feel good. We haven't talked at all about anal intercourse. Many cultures, there is a prohibition on anal intercourse, but it can also be pleasurable for some people. And so, it's when you can talk openly with your partner, your husband or your wife, then you can find out or discover together what is going to bring somebody to orgasm. But many women fake orgasm in my country. They pretend to have an orgasm, but they really don't. And so that's kind of a problem, because if you making the guy think that you're having an orgasm and you really haven't, then he might just keep doing the same thing and you're not going to make progress towards having an orgasm. It's really there's so many influences on having orgasm.
I have a question.
Yes.
Actually, you talk about orgasm of the women. Is it naturally? Because I don't see whether it is commonly. Maybe 3/4 of the women, they have their slow stimulation to reach orgasm, but I may say maybe to 1 or 2% of women, maybe they may have the same sense like a man, by the way, what I've learned. So
Oh yeah.
Like the
Oh,
men,
yeah.
sometimes some of the men, of course, they have the same resilience. They cannot even get into that orgasm quickly. But women, majority, we take from the majority. But some of the women, they are quick to be stimulated when they are closer
Yes.
to the men, the opposite sex.
Yes, yes. This is true. Yes, these are all averages. You know, that yes, there are men who can not reach orgasm. It doesn't mean there's anything wrong with them. Every now and then, you know, that happens. Not even just every now and then, it could happen frequently that a man could be aroused and still not reach orgasm. And there are women who can be, you know, aroused and stimulated just as fast as a man. And in fact, many times women are aroused just as fast as a man, but it takes them a little more work to get to orgasm. But not every woman is like that. You know, there are women who, again, can have multiple orgasms. You have one orgasm, and then if you touch her again, she can practically have another orgasm. And they say actually most women are capable of multiple orgasms, but we just, you know, are not in the right situation for that to occur. But yes, women can be just as sensitive as men and vice versa. Good points. Very good points.
Yes, my question is, what can we do as men to make sure that they reach their orgasm?
That's a really good question. That's a really good question because again, a lot, and I talked to many people, many men who've asked this very question because again, you know, sometimes women don't even know. They've never figured out how to get themselves to orgasm. And so the best thing a man can do is to take time and to have a dialogue with the woman about what feels good. Now, many women have not been taught to express that. So he may have to reassure her, I really want to know. You know, some women love to have their breasts touched. For other women, it could be painful to have their breasts, you know, squeezed or the nipples squeezed. Some women, you know, their neck is a sensitive zone. For other women, it might irritate them. So by having that dialogue.
Your next here is a sensitive zone.
Pardon?
Okay.
So have that dialogue.
Welcome.
Yeah,
Because
okay.
describe the area you talk about. The sensitive part, like the next.
There's
Where actually you can get her to reach the orgasm.
Oh, well, she's probably not going to reach orgasm by kissing her neck.
For the temperature to rise.
Okay.
Well,
Okay, there's an issue also that with the Muslim women who had circumcision, that their men have to run away from them because they will never get satisfied.
Yeah.
Yeah.
Yes. Again, it's very true. A woman who's been circumcised may not be able to reach orgasm. I did have the woman I was closest with who had been circumcised out of Egypt had the clitorectomy, so the tip of the clitoris was removed. But she still had some of the clitoris sensations, so it did take her a while, but she was able to reach orgasm. The clitoris is really kind of the secret to getting usually stimulating a woman to be to orgasm. And that can be done through using your hand, or if you don't object to oral sex, it can be done by, you know, oral sex on the woman, you know, stimulating the area with your tongue or your mouth, or sometimes even other little toys that you might use.
The right position on your mouth, your tongue. The culture.
That's what I'm saying. The culture. But that is, you know, there. But more than anything is you have to help the woman.
Okay. In addition to what she has said, I did not get the right answer from that because after they have been compensated, the women, especially the women who have already been given circumcision. So how far will we get the satisfaction through sexual? If that area is removed
to our families. That's why we
if that area of sensitivity is removed, they remain without sensitivity in the body anyway. how do we certify them through sexuality?
You know, I actually don't know the answer to that. But I do know that many women, it is the physical closeness, the being next to a man's body, that connection that is emotionally satisfying, even if they cannot reach orgasm. But I honestly don't know the answer to that. I really don't. Maybe somebody else knows. If a woman has already, if the entire genital area has been removed, how do they experience satisfaction, if they even can? I don't know. Does anybody there have?
They'll never get satisfied. They will never get satisfied. Only the men have to run away from such
Because it takes too long.
By the way, you know, I will be asking them why is it important for you to emphasize the women. They say sometimes it's very important for women to understand the feeling of a man, because if they are very near to the man, they cannot feel whether they have a sex in there. But I don't see, when I look at the women who have already been circumcised, they are more likely to love men than the women who are not circumcised, by the way. But based on their culture, they said we done it purposely in order for them to shy away from men because they don't have feeling. But when you look at them physically, they have that too much need than even those who are not circumcised.
That's interesting. That's very interesting. Yes, we are thinking that, you know, girls are circumcised so that they won't have sex. But then, you know, there's this big focus on what is missing, perhaps, you know, because, you know, now they know that they, you know, they can. But, you know, I have not done enough research. I think you're right. The woman who said, if you know, if you've had the severe forms of female genital mutilation, you may not be able to reach orgasm, but you may still be able to enjoy. You might be able to enjoy sex if you haven't. If there's enough of a opening left that there can be painless penetration. Sometimes women are sewed so much that they can hardly even menstruate through their vaginas. So, you know, it depends on what's been done. Yeah. I see that we're almost at the end of our time. I know we got started a little bit late, and I'm just going to skip, if I might, to one. I pulled up some laws on human sexuality in South Sudan. You know, adultery is illegal, rape's illegal, marital rape is still allowed. And I found it interesting that sex between men is illegal, but they don't say anything about sex between women. So I don't know the situation on that, but there are some norms that impact reproductive health in South Sudan. Like it's expected that married women are going to have many children. And once a girl has started menstruating, that she's ready to have children. But we know that being physically ready to have a child does not mean, just because one's menstruating doesn't mean that the rest of one's body is ready to have a baby. And it also doesn't mean that they're emotionally or intellectually ready to have a baby. So one of the things that was recommended when I was reading this information about cultural norms on reproductive health, and somebody one of you already said this, is rather than talking about, you know, birth control and to not have children, talk about it in relationship to child spacing, you know, or having, you know, child well-being, because obviously if there's more space between your children, then, you know, like not just 10 or 11 months, you get pregnant right after you had the last one. But if there's more space, there's going to be more resources. The child will tend to be healthier. And that will, you know, that will help the health of the whole family to have more economic resources, their ability to send the kid to school and so on. And I was looking at, you know, just how we change the norms is sometimes we have to change the expectations, you know, about what is appropriate. You know, having 8 or 9 children, maybe that's not so good these days. Maybe having 3 or 4 is more reasonable. But, you know, it depends upon, you know, again, what the what the situation is, what the context is. But the literature talks about trying to create new norms, so that, from everything from, we don't marry until we're 18 at least, we don't force women to have sex. Girls learn how to say no to having sex, and avoiding getting pregnant until they're older and married. Things like that we can change. And a lot of this requires men, being an important part of that voice to stop gender-based violence, to, stop forced marriage. Those are, parents, to stop early pregnancy and so on. Are there any, I don't think we have time to go through the sexually transmitted infections, but are there any other questions?
Yes, there was a question I wanted to ask.
Sure.
The part of circumcision.
Yes.
Is there a specific age for a boy? Let me say a boy.
Or a man.
Or a man.
Yeah.
Yeah.
No age. There's no age.
So,
But
right away from birth, we can.
yes,
But it's also
like
risky.
after
Is it
some
not
days.
risky?
Risky
Because
because you
at
can
least when we do it,
No, it does not.
my opinion, at least when we do it, when the child now knows something about pain, at least when something goes wrong, I can say it is paining somewhere. Because we are dealing with nerves, which are very tiny, especially when they're still at birth. And I've seen this practice, people are doing it in my country, straight away from birth, they circumcise it. But when you ask the mothers, most of them, they're saying, I don't want to waste time waiting until that time. I just want to finish this story so that I be free. You as a mother, you're trying to free yourself.
Yes.
Forgetting the risk on the baby.
Yeah.
That's why I'm asking. Is there specific?
Yeah, I hear what you're saying about wanting the child to be old enough to where they could let you know if there was anything wrong because of their pain. In my country, it tends to be done at birth. The baby's born, and before they leave the hospital the next day with the mother, they are typically circumcised. But there's also still a lot of pushback in my country, or starting to be pushback against circumcision until a man or boy is a man and can make his own decision about whether or not he wants to be circumcised. That's not a big perspective, but it is a perspective. And because I think the thinking of having it done when they're newborns is that they won't remember the pain. Now, whether that's true or not, I don't know. But it's very uncommon for there to be circumcisions in my country beyond a newborn, except in, I guess there is the Jewish faith will do when the boy's a little bit older, like when they have their bat mitzvah. And so, but I think, again, that's pretty uncommon. And again, we've had problems in the US with these, with the circumcision of Jewish boys when they're, this age, 12 or so, again, mainly because it wasn't done with clean instruments in a clean setting and so on.
Okay, because of time also, there's another question I've put it somewhere. The issue of, you explained something about the chromosomes, the X and Y.
Yes.
Giving. But then I've related it to something, there's something common these days, especially in our communities, where women, people reach into the stage of couples getting divorced because of a woman were always categorized giving birth only to girls. They try the first, the second, the third, even the fifth born is still a girl, and they're trying to find out they want a boy. So in the end, it's either you are divorced or it leads into polygamy, where you marry another woman because of this person is giving birth to girls only, or giving birth to boys only. So my question is, who is responsible?
Well, that is a very good question, and it is actually it's the sperm. It's the sperm that decides whether if the sperm that hits the egg is X, it's going to be a girl, and if the sperm that hits the egg is a Y, it's going to be a boy. So some would say that we used to think it was about the woman deciding. Really, it's a combination of factors. One, it is the sperm, but that also has to do with when you have sex in relationship to ovulation. And I don't remember which way it goes, but one of them, I don't know if it's the X or the Y sperm that swim faster. And so you're more likely to have, one gender if you have sex close to ovulation, and you're more likely, I think it's the girls that you're more likely to have if it's been a day or two, after ovulation, because those sperm live longer. But there's also, I did talk to a fertility specialist in the Emirates, and he said, because it's also about acidic and alkaline environment in the vagina, that can also end up having impact on, because in the same way that one of the sperm swims faster and the other one lives longer, one or the other survives better in an acidic environment versus an alkaline environment, but I don't know which it is. So it really ends up being, even though it's the sperm that kind of gets into the egg that makes the decision, there are things in the women's body that can, again, like the alkalinity or acidity of the vagina that can have some impact on whether or not the X or the Y sperm get through. But yeah, it's usually not the woman's full responsibility when she doesn't have anything but girls, because that means that, again, the Y sperm haven't made it to the egg, and that could be because of when they're having sex, in relation to ovulation, and also other conditions in the vagina.
Okay, there's something I would like to just know, sorry, because of time. Yeah, the point that was talked about, the circumcision of the children.
Yes.
Mostly here in Juba, people say the reason why they circumcise babies is because when they're still small, the pain tends to the injury, the wound tends to get healed so faster. So could that be the reason, or is it true?
No, I think it is. I think it is true, because when you haven't,
they don't even feel pain.
I think that
there's no too much blood, and even still.
So that one is okay.
Okay, another
They don't go and play. Yes.
There's another question. I think that was clear, Sophia.
Yeah,
okay.
Thank you so much. I think I've never spoken, though I was once giving some explanation on the keywords at the beginning. But I have a specific question on the issue of infertility. Given the anatomy, the natural anatomy and functional physiology of the female and the male reproductive organs, what could be the specific causes of infertility naturally to both the female and the male?
Yes, that's a really good question, and I can't give you a full answer because I don't have my notes in front of me, but I did just teach this to my other class. Obviously, there can be a variety of reasons. One cause of infertility could be the man's sperm count. The sperm might be fewer in number than it should be, or as I mentioned earlier, some of the sperm might be deformed, like so that the tails don't swim like they're supposed to. And this can be from, again, toxins in the environment. It could be from drinking alcohol or using drugs that can impact the quality of the sperm. So that's one thing, the quality of the sperm. Another, another,
different thing. Then you don't know the biology.
another thing is that
Yeah, please proceed.
Yeah.
yeah, there could be scarring in the vas deferens tube that blocks the sperm from, you know, getting through to be able to come out of the penis. In the same way that there could be blockages in the fallopian tubes that doesn't allow the eggs to come through the fallopian tube to be fertilized. Both of those blockages in both the man and the woman can be caused by sexually transmitted infections that are not taken care of right away, and it ends up creating scar tissue. And that scar tissue blocks, again, blocks the fallopian tube or blocks the vas deferens to be able to get the for the egg and the sperm to be able to meet. There can also be women who, again, if you get too thin, who may not ovulate anymore. Women can also have problems with the uterine lining. Endometriosis is a problem that can definitely impact women being able to get pregnant because the lining of the uterus is problematic. And usually, a lot of times, those women have very heavy, difficult periods. So again, it could be the cause of the lining, and it could also, let's see, the lining. It could actually even be with the woman, the cervix could be closed and not be open a little bit like it's supposed to be. And that can actually be fixed pretty easily. The doctors have I don't even know what it is, but different size little tubes that they can insert into the cervix to get it to open to the amount that it should normally be. I don't know why it gets closed like that, but I do know there's a way to open it back up. And beyond that, obviously there can be hormonal problems, that could impact either ovulation or sperm, sperm growth too. So those are the main ones I know is blockage, and different, environmental toxins that can cause problem with sperm quality. And for the women, there can be problems with the, again, both of them can be blockage, but also with the endometrial lining. And I know there must be more.
One of the factors which I may even extracted that may lead to what we call infertility, early sexual intercourse, that may lead to fertility. Infertility, definitely, when the child, especially the young girl, before even she start ovulation, start using herself, immediately all those sperm may not be shut out because there's no any system that can shut them out. Immediately may cause some sort of damage inside the organ, by the way, the reproductive organs. At the same time, the early use of contraceptive pill. Once you start using the contraceptive pill earlier, until the time she will get married, all these effects of contraceptive pill use may result to infertility. And that definitely, some may connect it with gender factors, genetic factors, which is related on their way of the background as it is related to harmonious problems or enzyme.
Yes.
And thank you. That was.
Yes, I do agree with you that having sex before the body is ready could cause injuries that could then cause, like, again, scar tissue that cause for infertility problems. Again, most of the time, having, again, if there's not, depends upon, if there's injuries, if there's not injury, then having intercourse early should not have an impact on fertility. And again, most of the time using like hormonal birth control does not have a long-term impact, but it could on anybody, not just because they, started using it when they were 12, but also just, anybody could have a negative reaction to contraceptives. I think, again, we don't want to encourage our kids to be sexually active, but we certainly want, if they are going to be sexually active, for them to not get pregnant or STIs from this, or not to end up being a victim of rape, because these will have much longer negative impacts on our children and our communities. Yeah, so we may want them to not be sexually active, but it's probably less of an impact to be using birth control until they get married, versus having a baby at 12 or 13 years old, when the body just may not have, the pelvic bones the hips haven't spread enough yet, and so on. So I think we do have to be cautious, with hormonal treatments and so on, but usually they're pretty safe. I think that's it. I'm sorry I didn't get to my pictures of sexually transmitted infections, but we want to make all of these available to you. So I will probably be sending you my PowerPoint slides. I did not have any readings for you to do, but we're going to be creating packets for you with the readings from Brendan on last Friday. On Thursday, we're going to be having a workshop on case management and the Child Protection Information Management System. And then on Friday, Brendan is going to come back and do more on actual child protection response. Next week, we do not have any workshops on Tuesday and Thursday, but we do have one on Friday. And that's with Dr. Shirley Gatiano-Gable on human rights-based social work, so that you can, help teach these community workers how to come from a human rights perspective. So, are there any questions or comments before we wrap it up today?
Yes, one of my brother was putting one of his comment here, which is actually relevant to question that we talk about. He talked about that lack of practice. By the way, I may agree with him. Back home before, I had a lot of story back home. Some time back, people were not unable even to be close before marriage. They were having that culture, no sex out of marriage.
Yes.
One can go up to 30, 40 years without making sex.
Yes.
As a result, majority of them end up without bearing a children. Yes.
Yes.
And that is confirmed by the way it was a research done.
Yes. Obviously.
So it might be one of the reasons too, is one can lead to what we call infertility. Infertility, I mean.
Yeah.
Practice. Yeah.
So what I heard was that
it is true.
that some people don't have sex for 30 or 40 years, and then they might be infertile into that. Yeah, I mean, people certainly can go decades without having sex. And I would say if it was for a woman going 30 years after she was had started menstruating, she might already be time for menopause. Some women go through menopause much earlier than 45 and 55. Like in my family, women go through menopause in their late 30s, and by the time they're 40, they're done. They're in menopause. So that could be another thing. If you wait too long, you might have difficulty getting pregnant. In fact, we see that a lot in my country, that because of the economy and jobs and gender roles, many women are delaying getting pregnant until their 30s and later, and then sometimes they have difficulty between them and their now older husbands as well. Many times women do shoulder the blame for infertility because they don't want their husbands to feel ashamed or anything, but there's no shame in infertility. It doesn't mean that you've done anything wrong. And often there are solutions too that can be identified so that you can still have, your family. I really appreciate y'all coming to this. The most important thing, and I think you all were all there, is being able to have these open conversations to try and talk about anything, even things that are taboo, that their students will be able to ask you. And if we don't know the answers, we just have to try and find them.